Most common, second most common cancer that a woman can get. That's why when we are starting to be sexually active, that's when we start our pap smears. And pap smears, that's what it's for, is for cancer of the cervix. Okay? HPV, these are all risk factors: early sexual activity, multiple partners, low socio-economic status, smoking, birth control pills, a weak immune system, geography, and DES exposure. And here's some images we already went through. Here is a chart that's in your book. Symptoms: vaginal discharge, pain after sex, bladder irritability, low back pain, and ureteral obstruction. They can do a biopsy, and what they do is they call it a cone biopsy because they go doing there and they take a cone-shaped piece out of the cervix. So, and this y'all informed me was the HPV vaccine that they do. Okay, there's stages 1 and 2. It could be a normal size and echogenicity. Did you still have that one that we can follow up on?
Oh, no.
Yeah.
I mean,
Okay,
I read
we'll look at that. Hematometra. Hematometra means what?
Blood.
Blood in the uterus. Blood in the uterus. That happens because the cervix is closed. It's stenosed. So blood cannot get out of the cervix, and so it backs up into the uterus. Stage 3 and 4, you'll have a bulky cervix, you'll have bladder invasion, hydronephrosis. Hydronephrosis is where you have too much fluid in the kidney. Liver mets, and then you can have lymphadenopathy, meaning you have lymph nodes that can be enlarged because that's how cancer spreads, is through the lymph nodes. Imaging, you can do translabial, also called transperineal or translabial. They both mean the exact same thing, or endovaginal. Endovaginal is also called EV, endovag, transvag, they all mean the same thing. Anytime we have cancer of the cervix, we also want to make sure there's not hydronephrosis. If there is a reason why the fluid cannot get out of the kidney, then it will back up. Okay, then we'll look for nodes and liver mets. CT and MRI. MRI is really good for the early staging, and especially CT and MRI. They're more than likely going to do a CT because MRI usually they have only 1 or 2 units in a facility, and it gets backed up. So you can get into CT a lot sooner than you can get into MRI. Carcinoma of the cervix, it can look a lot like a lower uterine segment leiomyoma. That's a what? A leiomyoma. It's a fibroid. Okay, they also call them myomas, they call them leiomyomas. Now, they like to watch these, usually on an annual basis, because they can turn into a sarcoma. Yes.
Is this where we do the biopsy? Or no, pap smear?
We do a pap smear for cancer of the cervix. Okay, now, because we have an internal and an external os, okay, so I'm gonna tell you a little story. So, after my second child, I had a prolapse. So they scheduled me for a hysterectomy. The same day I got that diagnosis, they were supposed to do a vasectomy on my husband. My husband's appointment was first. He comes in and he goes, well, since you have a prolapse, we're not gonna sterilize your husband because you're gonna have a hysterectomy. I said, is that what's causing the burning sensation? I said, I feel like it's really burning down there. He said, possibly. So I did my hysterectomy. Come to find out I had cervical cancer at the internal os, not the external os. And so it was a good thing that I had a prolapse because if it started on the inside of my uterus and had to eat its way all the way out to the external os, so God is great,
Oh my God.
you know. And all I did was try to catch a keg from falling out of the back of the truck. And I tore the ligaments that held the uterus up. So I had a prolapse. So anytime they have a polyp, they're gonna watch it, because any type of a polyp can turn malignant. Whether it's in your gallbladder, whether it's in your cervix, whether it's in your endometrium, you're gonna keep a check on it. And also, if I have endometrial cancer, it can eat its way down into the cervix. Gestational trophoblastic disease. Okay, remember what gestational trophoblastic disease is. Okay. So I have what? My egg meets my sperm, and I have what? A zygote. It multiplies, 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 and multiplies. And then it's gonna, when it gets to like 16 cells, it's called a marula. It keeps on dividing. And let's just say 140 cells. Then it's called a blastocyst. Okay, a blastocyst. You have an outer layer called the Okay, that puts out enzymes, kind of like meat tenderizer. Okay, it's gonna put out enzymes. Okay, then you have an inner layer that's called the cytotrophoblast. Cytotrophoblast. And that has villi that act as an anchor. Okay? Okay. Inside that, you have an inner cell mass. That's going to be the baby. Okay? Now, gestational trophoblastic disease. I can have a partial or I can have a complete. They think it's because 2 sperm have penetrated the egg. 2 sperm penetrated 1 egg. That's what they think happens. They don't really know for sure. Okay? If I have a total molar, because I can have a partial or I can have a complete. We're going to talk about the complete. Okay? So the inner cell mass is missing. Okay? So what happens is it implants in the endometrium with the enzymes. The enzymes have no control, and so they penetrate and go all the way out into the myometrium. The cytotrophoblast, the villi, they're still looking for their base, the zona basalis, but there's no way of stopping it. So it goes haywire. And it takes up the whole myometrium, takes up the whole endometrium, takes up the whole myometrium. Okay? And that's gestational trophoblastic disease. With this, I have high HCG. Usually it's in the hundreds, it's going to be in the 100,000s or millions. Okay? My uterus is going to be larger than dates. Because the trophoblastic cells have gone haywire, my uterus keeps getting bigger and bigger and bigger and bigger because my body thinks that it's pregnant, but it's not. It's the trophoblastic cells that have gone haywire. Okay? That's where you get, I can also have a pregnancy with that. I can have, with a partial, I have a baby, but I also have gestational trophoblastic disease. They take the baby. Because why is this? Choriocarcinoma. It can turn into a cancer. Remember the 16-year-old girl I was telling you about? Turned into cancer. Okay, so it's also called an invasive molar pregnancy. Okay, because if I have a partial, it's called an invasive mole. Okay, and then you can also have choriocarcinomas. Okay, so, here's just what I drew. Okay, so you have a sperm and you have an egg, and it usually will be 46. Okay, 2 sperm, so this is doubled because the sperm usually has 23. This one has 46, and the ova, and it will not survive. Here, 2 sperm hit 1 egg, and then you have an overabundance of chromosomes also. Okay? So the invasive mole contains the chorionic villi. Remember, the chorionic villi. This is where all the villi is, because remember, the villi is what helps burrow the down and anchor to where it needs to be. Okay? I'll have high HCG, and I'll have heavy bleeding with it. Okay? And I have hyperemesis with it. Hyperemesis means that I can't stop throwing up. Okay? Choriocarcinoma. You have absence of those chorionic villi, and it occurs after a complete or a partial molar pregnancy. It can happen after a normal pregnancy, a stillbirth, a spontaneous abortion, and an ectopic pregnancy. Now, what's the difference between a spontaneous abortion and an ectopic pregnancy?
Spontaneous is when it happens on its own.
Yeah, I abort for no reason. Okay, fine. One day, tonight, I have a miscarriage.
But before
Before a certain age.
12 weeks or after 12 weeks?
No, I think usually a spontaneous abortion happens in the first trimester. Now, we're going to be studying miscarriages later
So
on.
that's what's called, what they call miscarriage?
Abortion and miscarriage are the one and the same. So that's how come when you ask your patient, have you ever been pregnant? And you don't ask them, how many abortions have you had? That's not politically correct. But if you say, how many babies have you lost? How many miscarriages have you had? Because the word abortion is not politically correct. Okay. Why? Because if you asked me if I had an abortion, I'd say no. Because I don't want you to know that I made that choice to abort. But if you ask me, have you lost a child or did you have a miscarriage? Yes, I did. See what I'm saying? So it's just a play on words. And an ectopic is anywhere besides the fundus of the uterus. Okay? If I get pregnant in the lower uterine segment, that's going to put me at, it's not where it's supposed to be, so this is going to throw me in the lower uterine segment into high risk. Gestational trophoblastic disease, it can look pretty wicked, very complex, and hypervascular. This is about the same thing. Okay, placental site trophoblastic tumor. I've never heard of this. It arises from the trophoblast. You have a mild HCG elevation. It presents months to years after a term delivery. Never heard of that, but I'm 65 and I love learning something new every day. Okay? It can infiltrate your ovary, your parametrium. What is the parametrium? Around the uterus. It can also affect the rectum, or the bladder. The rectum is posterior uterus. The bladder is anterior uterus. Epithelioid trophoblastic tumor. It is a form of the PSTT, the placental site trophoblastic tumor. It can present 6 to 7 years after a delivery. It affects the ovaries, a decolletean cyst. Oh, decolletean cyst. This is from last chapter. Why do I get a decolletean cyst? High levels of HCG. I can have gestational trophoblastic disease. I can have multiple pregnancies. There's certain cancers that I get a decolletean cyst. So anytime I have what looks like a corpus luteum cyst, but on both sides, now it's not called a corpus luteum, it's called a decolletean. T2. Deca begins with a T, it means two. Okay, it's an easy way to remember. Okay, so it's seen in 25% of the cases. It increases post-molar trophoblastic disease. I've had trophoblastic disease, and after I've had the disease, this can happen. That's all that means. They can do a DNC. A DNC, they go in there with the uterus, into the uterus. They have a little, they call it a cuteric, or a cuterage, and then they go in there and they scrape the lining of the uterus, and they call that a DNC. Okay? You'll have to go through serial HCG studies to make sure that it's falling. It won't fall immediately, it falls gradually. Okay? And then you'll have vaginal bleeding. Symptoms: cough, hemoptysis, and this means you're spitting up blood. You're coughing up blood. You can have methotrexate with or without folic acid, and you can have chemotherapy. Those are the two options that you have for gestational trophoblastic disease. Here is a choriocarcinoma in a large uterus, and you can see that you have this and this and this. This is the normal myometrium. A sonographic appearance of a choriocarcinoma. It's focal. It looks hemorrhagic, and it does, doesn't it? Doesn't it look hemorrhagic? Homogeneous. Okay. You can have masses in the cervix or the vagina, and it can metastasize up to the liver. If you have PSTT sonographically, it could look normal. You can have an irregular mass. You'll have to go and get a definitive patient history. The uterus will be hypervascular with a chaotic color flow bladder, meaning it will be mosaic and it will be hypervascular. Hypervascular. This is called chaotic. Then CT and MRI. Anytime we find something in ultrasound, they're going to either send it to CT or they're going to send it to MRI. Anytime CT or MRI finds something, they either send it over to CT from MRI or to ultrasound, and then CT will do the same. They'll either send it to MRI or send it to ultrasound. They want the disease to be diagnosed with 2 different modalities. If you have your exams here and you decide, oh, I don't want to go to Bental, I want to go to Methodist Sugarland, okay? You'll take your medical records with you,